Very good morning to you. My name is Kalache, and I'm here representing the International Longevity Center, Brazil. The International Longevity Center was created first by Bob Butler, a name that is very familiar to all of you. And now we have a federation of ILCs spread around the world, and I have the honor of representing the ILC Federation as the president of ILC Brazil. I welcome this initiative by IOM. I've been honored by participating in the organizing committee, and I would like to reflect for a few moments where we were at the time when I was serving as director of the World Health Organization Program on Aging and Health. We're back in 2000, and as Ms. Greenlee has already indicated, we were confronted by this tremendous problem that was hidden. It was there, we had awareness, and I used to compare that we were in relation to elder abuse as we were 30 years ago, 30 years before, in relation to domestic violence. Societies denied it, would brush in the carpet, but the reality was there, that ugly face, perhaps the last stigma, the last taboo, not wanting to confront the violence of against older people, and the reality that it is there, insidious. And as you have also indicated, Ms. Greenlee, the world is aging fast. We will double the proportion as well as the number of older people within the next 15 years. By the year 2050, we will have 2 billion older people in the world. That means that there will be as many older people in the world as there were people altogether, the total population in the world in 1950. It's only 100 years, and we are going to see more and more of us, older people in the world, and in a very different context from that context in which I was grown up. I was in Brazil, a child in a very young country with few older people and a very large pool of potential carers to these older people. The reality is very different now with this ever-increasing number of older persons. For instance, in Brazil, we have 23 million older people today. By the year 2050, there will be 63 million. That means 3 times more older people in a click of your fingers. In terms of the history of human beings in this planet, it is nothing. And yet we are seeing this ever-increasing number of older people. And obviously, very importantly, we are seeing a decline in fertility rates that is even faster than the increase of older persons. When I left Brazil to do my postgraduate training in Britain, 1975, total fertility rates in Brazil was 5.8. Today is 1.7. In one generation, we have gone well below the replacement level, and we are not alone on this. More than 80 countries have already fertility rates below replacement level, most of them in the developing countries. So going back in 2000, when I was serving director of WHO Program on Aging, we were confronted with this situation, and we have joined forces with the newly created INPIA, International Network for the Prevention of Elder Abuse. And we launched perhaps the very first multi-centered research, and we named it Missing Voices, because that was exactly what it was. The missing voices of older people being abused, being subjected to violence of all kinds. And we did this qualitative research in 10 countries to unearth, to understand a little bit more about the factors, the determinants, the risk factors, but also how to prevent and how to deal. Listening to the voices of older persons rather than impinging on them what would be our views as gerontologists, as researchers, what we would understand is elder abuse. We have found that the most important dimension of elder abuse in the views of older people themselves was institutional abuse. Not sexual, not financial, not emotional, not psychological, but insidious, institutional. That is what older people most valued in this study in 10 different countries. The patronizing, making you humiliated, not hearing your voices, not listening, not paying attention to you. You become a subject. You become an object that nobody pays attention. Since then, since 2001, when we launched the Missing Voices, much has been done. Much has been done, for instance, with the Assembly in Madrid, the United Nations Second World Assembly on Aging, which launched the International Plan of Action on Aging, MIPA, as we call it, which devotes a lot of attention to elder abuse. This would be unthinkable 10, 20 years before the Assembly in Madrid. And it is important because it also has given the opportunity to establish the International Day for the Prevention of Elder Abuse. And I want to pay tribute to the person that I would single out as the first voice that said, we need an International Day for the Prevention of Elder Abuse. We need to call attention to this. It was based on her work in Canada, and we have here Elizabeth Podinex, who was the very first person, in my understanding, that has called for the importance of having a special day to create and to focus on this, and the phenomenal work that she has done, both in Canada, but also paving the way for the establishment of INPIA, the International Network for the Prevention of Elder Abuse, which is here represented by Susan Somers. So I want to thank you, Elizabeth, for your vision and your leadership on this. We know that at the root, we know that at the basis, at the root of age discrimination, elder abuse is ageism, discrimination against older persons. And this is why we are very committed to a rights-based approach when we talk about elder abuse, and the importance of having legally enacting policies and legal frameworks. I defend strongly that we need a convention at the United Nations. In my capacity as global ambassador for Help Age International, this is something that I strongly believe, but also as a Brazilian. And we see Latin American countries today firmly committed to fight for a UN convention of all vulnerable groups of the population, children, women, indigenous populations, disabled people. They all have today a specific convention rights of their groups to defend and protect their rights. The only one that is missing out is the one that is increasing fastest. It doesn't make sense. And we have today the what I call A, B, C, U countries leading this process, A for Argentina, Brazil, Chile, Uruguay. And it is for a very good reason, a reason that gives me hope. It gives me hope because we, I'm saying now this as a Brazilian, and all the ABCU countries, we had to fight hard to defend our rights when we were young because we had dictatorships in our countries. Today, the same cohort, my cohort, is taking leading positions in our societies, and we are not going to allow this to happen again in our lifetime. Therefore, the commitment to rights of older persons, and therefore the understanding that we have to confront elder abuse for what it is. And if I take just a second to reflect on what is happening in Brazil, it is a country in which is much better to age today than it was, say, 20 years ago, for two very important reasons. The first is that we have universal right to health. It is written in the Constitution post-dictatorship in 1988. It is a very important achievement for all citizens, including older people. So we have the right to health. And the second is that more recently, over the last 12 years, we have non-contributory pensions, which means that every single person over the age of 60 will have the right to an income, regardless if that person has contributed or not to Social Security. It changes completely the way you see, regard yourself in society. You have a basic income, you have the autonomy to decide where you're going to spend that money. And guess what? Older people, poor older people in my country, are not going to buy with this pension makeup. They are going to buy food for their grandchildren. They are going to buy a drug for treating a diseased child. They are going to buy a sewing machine for the daughter to increase the income of that family. But, and that is what is so tricky, the same right to have an income is also opening the opportunities for financial abuse. Because these older people now have an income, and they will have their alcoholic sons or their drug-addicted grandchildren taking you to the bank and getting that money for their abuses on drugs. We have to be aware of how complex the whole situation of neglect, abandon, with families that are a base that is much narrower, with far less potential carers in these families, and these complexities that a new development that is protecting millions of older people in our continent, in Latin America, is also a risk factor for financial abuse and other forms of abuse, because these people now have a regular income that many of the other family members don't have. So this very first panel is to give a global overview about elder abuse. And again, I commend the organizing committee to start the day giving this global perspective. And we have three very experienced professionals that will be talking about this. I call, therefore, Jill Livingstone, who is a professor of psychiatry in older people in the Mental Health Sciences Unit in the University College of London, and consultant on age psychiatry. She's interested in clinical research in dementia, from epidemiology to pragmatic randomized controlled trials, and from diagnosis to the end of life. So is Jill here? Could you please join us here? Then we have Ronald Acierno. He's director of the PTSD clinical team at the Ralph Johnson VA Medical Center and a professor in the Department of Psychiatry at the Medical University of South Carolina, where he is director of the Older Adult Crime Victims Clinic. He's also the executive director and founder of the nonprofit Veterans on Deck, an organization that uses sailing as a means of community reintegration for veterans. Could you please join us, Ronald? And the third speaker is Elsie Yan, who is an assistant professor in the Department of Social Work and Social Administration, University of Hong Kong. Her research interests include domestic violence, mainly focusing on factors and impacts associated with elder abuse and intimate partner violence in older couples. She's also conducting research on dementia care and elder sexuality. Could you please join us, Elsie Yan? So we will start with Jill Livingstone. We'll have plenty of time, I expect, for a dialogue with everyone. So we'll have here Jill starting, and then